Namaste, Betu. I am JVN Dr. RENCY KOSHY. I am from the Department of Faculty of Physiotherapy and Diagnostics. I am an assistant professor there from the Department of Physiotherapy. Today we are going to discuss with facial nerve palsy. What is facial nerve palsy? It is a nerve palsy that is caused by the lesion in facial nerve, that is 7th cranial nerve. 7th cranial nerve, it supplies the face. It is a motor and sensory nerve which supplies face. It controls the facial expressions, facial movements, the muscles of mastications, your eye movements, the sensation around these faces. And if we are talking about facial nerve palsy, it is basically divided in two parts. That is upper motor neuron lesion and lower motor neuron lesions. So facial nerve palsies can be purely facial palsy. It can be classified as complete or it can be partial. This is the first type of classification, and second type of classification is unilateral and bilateral. Complete facial nerve palsy is the facial palsy that paralyzes your complete face, and partial paralysis is half of the side of the face is get paralyzed, or we can say ipsilateral or contralateral side of the nerve lesion gets affected here. In a unilateral nerve palsy, again one area, that is ipsilateral. In basically in unilateral, ipsilateral and contralateral, these are the classification in unilateral. It can be if the facial nerve palsy is affected on right side. If we talk about ipsilateral, the same side of the paralysis takes place, and if it is contralateral, right nerve lesion can cause paralysis to opposite side, that is contralateral lesion. Bilateral, both side of the face is completely paralyzed. Here, if we talk about upper motor neuron lesion, here the classification is of for unilateral. In upper motor neuron, unilateral paralysis takes place, and here we can differentiate from frontalis and orbicularis oculi muscle. These two muscles are partially affected, like these muscles actions are partially affected. But if it is a lower motor neuron lesion, that upper motor neuron lesion is generally termed as facial palsy. But if we talk about a lower motor neuron lesion, it is Bell's palsy. People usually get confused that facial palsy, facial nerve palsy or Bell's palsy is the same thing. No, it is not same, it is different, because facial palsy, if we say facial palsy, it's the upper motor neuron lesion. It affects the upper motor neuron, the supranucleus of the facial nerve. Here unilateral paralysis takes place. Frontalis and orbicularis oculi muscles are partially spared. Here only one side of the paralysis takes place. But if it is lower motor neuron lesion, it is Bell's palsy, here one side get affected, or it can affect the both sides also. Here if it is said Bell's palsy, what does Bell mean? Like here we can see the person, or like when the patient comes to you, we assess. The first step he does is the assessment of the patient. For assessment part, it is first the observation. On observation, we find out that patient's eyes are not closed properly. Patient is unable to close their eyes. This unclosure of eyes, the eyeball movements, due to this eyeball movement, the term came Bell's palsy. In a lower motor neuron lesion, when we talk about facial nerve palsy, here what are the main causes? What we can see, first causes can be infection, maybe viral infection. If it is viral infection, it is mainly due to or mostly due to herpes virus. Herpes, that too zoster. Herpes zoster virus causes chickenpox. This is the easy way to remember this virus that causes chickenpox, that is herpes zoster virus. We have other herpes simplex also, but that doesn't cause the facial nerve palsy. And other infection, viral and bacterial infection or any trauma, direct cut to your facial nerve, or any road traffic accidents that it can affect that provides any trauma to your head or this area of lesion. Any type of secondary cause. This is a primary causes. Some secondary cause also can come. Like it also has some neurological causes. We can see MS, multiple sclerosis, Parkinson's disease, metabolic conditions like diabetes. Diabetes also may cause facial nerve palsy. These are few of the causes that we can see that cause this facial nerve palsy. What are the signs and symptoms here? In sign and symptoms, we can see facial expression is lost in Bell's palsy. Facial expression, eye closure, drooling of saliva, loss of taste sensation, muscles of mastications. These all are affected here in facial nerve palsies. The diagnosis, we can see some blood tests for any viral infection. We can diagnose CT scan, MRI for any head traumas, and any other the NCV for finding any nerve conduction of facial nerve, and EMG for the muscles which is applied. And the treatment we use is some of physiotherapy exercises. We use electrical stimulations, other exercises, massage, drainage techniques, and few of antibiotic drugs we use here. These are the few of the summary of your facial nerve palsy. Other details and the details of the physiotherapy part of this facial nerve palsy we will discuss in other class. Thank you.